Okay, guys, welcome to part 7 of your pharmacology lecture. We're going to dive into 3 more drugs. We're almost done, guys. Nitroglycerin, this is a big one, guys. All right, there's a lot of information to know about nitroglycerin. Yes, this is basically the exact same as the explosive, known as the most unstable explosive on our planet. The class of drug is an anti-anginal agent or vascular dilating agent. We'll talk a little bit more about that when we get to our cardiac section. The indications of this is for chest pain or anginal pain. Anytime you guys see anginal pain, it's just a sexy way of saying chest pain, okay? Contraindications, hypersensitivity. Again, this is something I've never seen out in the field. There's all kinds of literature online about it as well. Severe hypotension, we need to make sure that our systolic blood pressure on our patients is greater than 100 at the basic level, okay? So that is one of your caveats that you guys need to confirm on your patient before you guys give this medication, all right? Severe bradycardia, okay? Bradycardia means slow heart rates. If the heart rate's below 50, we can't give it, okay? So the systolic blood pressure must be above 100 or greater, and the heart rate needs to be above 50 or greater. Okay, drug interactions. We can produce a hypotensive state if the patient's already on any kind of beta blockers. All right. Remember those beta cells. Beta 1 cells are found in the heart. You got one heart. Beta 2 cells are found in the lungs. You guys have 2 lungs. If they are on a beta blocker, this could drop the blood pressure of the patient pretty significantly. Anybody that's on antihypertensive medications, calcium channel blockers, and or phenothiazines. And we'll talk a little bit more about that when we get into cardiac. Okay, guys? Tricyclic antidepressants, what we call TCAs, and antihistamines may interfere with the actual buccal absorption of this drug. Now, this drug is given sublingual. That means that we're going to give a spray or a pill, whichever form you guys carry, and your ambulance service, underneath the tongue. And these drugs, actually, the tricyclic antidepressants and antihistamines, actually give you a coating. It kind of coats the inside of your mouth if you guys did take it orally, which can slow down the absorption rate for nitroglycerin. Personally, I wouldn't really worry about that whatsoever. Administration, we do not give this to kiddos. We're giving this to adults. It is a sublingual, anywhere between 0.3 to 0.4 milligrams per tablet. Most of the tablets out there that you guys are going to see are the 0.3 milligrams. If it's the spray, it's the 0.4 milligrams. That's why I give you guys that range. Either way, you want to make sure that you do not exceed the max dose of 1.2 milligrams while you guys at EMT Basics are with the patient for the state of New Mexico. Now, let's talk about nitro. You guys have come on scene. You guys have confirmed or suspect that this patient is having some kind of cardiac event. You guys ensure that the patient's blood pressure is above 100, their systolic blood pressure is above 100. You guys have ensured that their heart rate's greater than 50. You guys decide to give them 0.4 milligrams of nitroglycerin under their tongue. You guys are going to wait about 3 to 5 minutes, and you guys are going to take that blood pressure again. You guys are going to reassess your patient, right? We're going to take that blood pressure again. Your systolic still above 100. You guys are going to check that heart rate, which is still above 50. Well, then you can give that second dose. Okay, then you can give another 0.4 milligrams, right? So now we have a total of 0.8 milligrams on board. Okay, we're also reflecting on the pain of the patient. We're going to talk about this a little bit more in cardiac. Okay, their pain level still up, their blood pressure still above 100, their heart rate still above 50. We can give that third dose of nitroglycerin. Okay. Now, let's say you guys give that nitroglycerin and you guys have checked that the systolic blood pressure is above 100, heart rate's above 50, their pain level is still kind of up there. First time around, you guys give them 0.4 milligrams. You guys wait 3 to 5 minutes. You guys want to give a second round, but you guys notice that their systolic blood pressure is now dropped below 100. You cannot give the medication. You are done. Okay? At the EMT basic level for the state of New Mexico, systolic blood pressure needs to be above 100. Heart rate needs to be above 50. No ifs, ands, or buts about it, guys. Okay. We also need to make sure that the patient has not used any kind of sexual performance enhancing drugs, or what we call SPEDs. Those are your Viagras, your Cialis, right? Any of those boner pills I mentioned earlier this lecture. Okay. Within the last 24 and 48 hours. Okay. And now look, right? Let's talk about these drugs. Let's talk about SPEDs. Guys don't want to admit that they're on them, right? Guys don't want to have to tell you that, hey, I took some Viagra, hoping to get lucky, and all of a sudden I'm getting chest pain, right? So you guys might have to explain to these gentlemen, right, that, look, sir, I don't care, right? I don't care if you took SPEDs. However, I do care that I'm about to give you a medication that can severely drop your blood pressure, that can do some serious damage to you if you are not telling me the truth about sexual performance enhancing drugs. And leave it at that. Okay? Just leave it at that. Right? I'll tell you guys the story of Viagra in class. Somebody remind me. Okay? I'll tell you how Viagra came about. It's actually quite the story. We have got to get, at the EMT basic level, you guys must call the MSEP, the Medical Control Emergency Physician. Remember, this is the doc at the receiving facility that you're going to be taking the patient to ask permission to give nitroglycerin. Okay? So again, when you guys go to call that doc, and you guys are supposed to go speak to that doc on the phone, make sure that you've already taken a full set of vital signs. Make sure you have already guaranteed that this patient, say that the patient has stated that they haven't taken any SPEDs, and tell them why you think this patient might be having some kind of cardiac event. Explain to the doctor what you're seeing. Paint them a picture. They are not on scene with you. Okay? You have to describe what's going on with this patient. Okay? So a radio report for an MSEP might be, hey, doc, my name is Patrick. I'm a paramedic with blah, 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 ambulance service. I have a 72-year-old male. He's complaining of chest pain. He's pale. He's sweaty. Respiratory rates at this. Heart rates at this. Systolic blood pressure is at this. Has a medical history of this, that, and the other. I would like to give 0.4 milligrams of Narcan. 0.4 milligrams of nitro. I have guaranteed that this. Assume that this patient has not taken any SPEDs. How do you feel about me giving that nitroglycerin? Boom, said and done. I painted a picture for him. Right? It's short, sweet, to the point. We're going to talk more about radio reports as well later on this semester. But short, sweet, and to the point. Okay? Some special notes on this as well, so make sure that you guys are calling an MSEP. So let's talk about this one more time. Things you must guarantee at the EMT basic level in the state of New Mexico. Systolic blood pressure above 100. Heart rate greater than 50. Patient has not taken any SPEDs in the last 24 to 48 hours. You have contacted an MSEP in order to give this medication. I forgot one. The patient must be already prescribed nitroglycerin in order to receive nitroglycerin from the EMT basic. Okay? Nitroglycerin tablets, when we put it underneath people's tongues, it can cause a burning sensation underneath their tongue. It's kind of like a side effect. Another big side effect of nitroglycerin could be headaches, could be dizziness, burning sensations under their tongue. It could cause nausea. It could cause dizziness as well. All right, so there are some kind of quite a few side effects that can come along with nitroglycerin. Okay, and last but certainly not least, nope, I lied. You got one more. Oxygen. Oxygen, yes, it is a drug. Yes, you need a prescription in order to have in-house oxygen. It's the class of drug. It's a gas. Okay, indications, anybody that has suspected hypoxia. Hypoxia just means low levels of oxygen in the blood, or any kind of respiratory distress from any cause. Okay, We will never withhold oxygen from anybody, and we'll talk a little bit more about that in our respiratory lecture. There are no contraindications. You can't be allergic to oxygen, okay? There are no drug interactions. Administration, adults and pediatrics, we got low flow, moderate flow, and high flow. Low flow is usually through a nasal cannula that's anywhere between 1 and 2 liters per minute. I want you guys to change that. Well, we're going to talk about that a little bit more. Don't change it right now. Low flow nasal cannula, 1 to 2 liters per minute. Moderate flow nasal cannula, anywhere between 4 to 6 liters per minute. And high flow, we're going to use what's called the non-rebreather at 10 to 15 liters per minute. We do have other devices that we use, and we'll talk about that more during our lab. You guys will get that in the first couple weeks of lab here, so that you guys can see the actual oxygen delivery devices and start learning the liter flows for each. Anytime that we're giving oxygen to our patient, put on the back burner that your patient can crash. Your patient can decline pretty quick, and that's for any patient, really, right? Remember that in EMS, we're always expecting the worst and hoping for the best, okay? So we always want to make sure and be aware that we might have to ventilate this patient for them, which means we might have to use what's called the bag valve mask and actually act as their lungs for them. We'll talk more about that when we get into lab. And giving 100% oxygen to all patients is completely 100% unnecessary. In fact, the target goal for any kind of medical institution or medical training institution is at 94% on the oxygen saturation. I know this is all kind of new info to you guys. We'll talk about oxygen saturations very shortly in the lab. But our target goal is right around 94%, okay? We want to make sure that if we can keep somebody at 94% on just 4 liters of oxygen, we don't have them on 10 liters of oxygen to keep at 94%. We want to give them as little as oxygen as possible in order to keep them and maintain as close as we can to 94%. We'll talk more about that in lab as well. Okay, now last but not least, this is the last drug that we're going to cover, is Pralidoxime, also known as 2-PAM. Remember that this is given in conjunction with the atropine that we talked about earlier. Remember that we want to give that atropine first, and then we're going to give the Pralidoxime, okay? The Pralidoxime is known as a cholinesterase reactivator. Indications are the exact same for atropine as Pralidoxime. This is for any kind of organophosphate pesticide or possibly fertilizer, or any nerve agent poisoning after atropine has been administered. Atropine first, then Pralidoxime, okay? And the only reason why we say that is back in the day it was called the Mark I antidote kit. And it was actually 2 pre-filled syringes, right? So it was 2 separate injections that we had to give to ourselves if we were going to enter a place with nerve gas. And we had to make sure that we give atropine first and Pralidoxime second. Now it's called the duodote. It's 2 doses in one, so you don't have to poke yourself once. And it's an auto-injector. So we're going to talk about auto-injectors and how to deliver auto-injectors to our patients and to ourselves. Remember, this is a drug that more than likely you will give to yourself if we do ever have some kind of major nerve agent exposure or some kind of terrorist event in our area. Contraindications for this drug, yes, this is technically an ALS level only drug. This is a drug, ALS, we mean paramedics, advanced life support. But this is something that you guys are trained for specifically out here in the state of New Mexico because of all the research facilities that we have out here. Your administration, the adult dose is 600 milligrams IM, intramuscular by auto-injector. It's also known as the Mark I antidote kit. It can be repeated 3 to 5 minutes after the first dose if weakness or fasciculations have not been resolved. So when somebody is exposed to a nerve agent, they go into something called fasciculations. And really what it is it's the nerves of your body reacting to whatever the nerve agent is. And fasciculations kind of looks like a seizure, right? But it's a different type of seizure. You can actually see the body start to twitch, and it usually starts in the head, right, where the brain is, the big neural center, right, big nerve center of our body, and it's like the body's twitching, and you can see it run down. It's almost like a ripple, like a wave, right, where you're gonna see like their eyes start to flutter. They might start smacking their tongue, right? They might be popping open their jaw, and then like their chest muscles might start twitching, their abdominal muscles might start twitching, right? Their legs might start twitching, right, all the way down to their toes. It's really cool to see. We can cause this as flight paramedics when we do something called RSI, or rapid sequence intubation. There's certain drugs out there known as paralytics that can cause neuromuscular agents. That can cause fasciculations. Either way, don't worry about that. Again, make sure, really what I want you guys to know about atropine and pralidoxime, know that's called the duodote. Now, know that it was called the Mark 1 antidote kit, or 2PAM. Make sure that you guys remember all the dosages for atropine and pralidoxime. Remember that you're given atropine first, and then the pralidoxime. Make sure you know the classes of each drugs and the indications, and you guys will do just fine. We got a little bit more to talk about in pharmacology, but that is it for your guys on the drugs. Guys, I understand that was a ton of information, all right? Please just make sure that you guys are studying the notes in here. Listen to these lectures as much as you guys need. Once we're done with this, we are going to start having weekly drug quizzes. These drug quizzes are going to be about 2 drugs at the same time, right? I might mix up naloxone and nitro for one drug quiz, or atrovent and atropine for one drug quiz, okay? I'll let you guys know what's coming up and what drugs to study. Once we're done with all the drug quizzes, we will be having the pharmacology exam. Please refer to your syllabus on the requirements for the pharmacology exam. If you guys have any questions, please make sure that you hit me up. I do have, I believe, 1 or 2 more lectures, parts of the lectures in this that I'm going to have to get through in order to finish up the pharmacology lecture, but that is basically the meat and potatoes of it, and we will see you guys next time. Thanks.